But first, an impasse in hospital insurer contract negotiations between Baptist Hospital and Florida Blue could have some costly repercussions for patients. To discuss that, we are joined by Jacksonville Today reporter Will Brown. Good morning, Will.
Good morning, Dan.
Before we get started, I want to disclose that Florida Blue and Baptist Health are both financial supporters of WJCT Public Media. Will, first question here. What is the primary issue here regarding this deadlock? Because we both know the names of these companies.
Yes, their healthcare costs are rising. Both Florida Blue, who's the health insurance provider, and Baptist Health, who's the largest health system in Northeast Florida, agree that there have been health costs that have increased since the worst of the pandemic in March 2020. And because of that, there's a discussion, debate, impasse, negotiations currently about the hospital-insurer agreement, which essentially is how much Florida Blue pays to Baptist to reimburse in-network services.
Now, folks, you should know that Will has been covering this intensely over the past few weeks. I've been listening to him do his interviews, and he has had some amazing interviews. So you interviewed Dr. Timothy Groover. He's the chief medical officer at Baptist Health. You also interviewed Tony Jenkins of Florida Blue. They both indicated they want this to be settled and to continue to partner. So let's hear what they had to say in their own words. First, Dr. Groover of Baptist Health.
Our goal is not to panic the community. But our goal, as Dr. Mayo said, is to inform the community, because I think the biggest tool that I can give you is information so that you can make proper preparations as we enter this period. Our goal, our number one goal, is to reach an agreement by September 30th with Florida Blue. We have to. And I think that the amount of good that both of these organizations bring to the table, it has to be preserved.
I'm an optimist, but we cannot come to an agreement if both of our intentions are not working towards partnership. I know ours is. We want an agreement. We want to make sure that we are providing high quality, affordable health care to this region.
So that first voice was Dr. Timothy Groover, Chief Medical Officer from Baptist Health. The second voice, Tony Jenkins of Florida Blue. And our guest today, Will Brown, did interview them both. So before we get into the terms, Will, the deadline, as we heard, is September 30th. The negotiations have been ongoing since February. So what happens if they cannot reach an agreement?
Well, I should start by saying they both are confident that they will reach an agreement. Both Dr. Groover and Tony Jenkins, who's the market president for Florida Blue, they are both Jacksonville natives. They both grew up here. They both realize the importance of both of those organizations because of their deep ties to Jacksonville. But what will happen on September 30th is Florida Blue customers, or members as they call them, will be out of network, which fantastically adds to the cost. I spoke with one union leader, Tammy Brooks Evans. She's the president of the Duval Teachers United.
Mm-hmm.
And their union has 5,000 members, represents 7,000 people, arguably one of the biggest unions in Northeast Florida. They all have Florida Blue. And she said to me specifically that out-of-network costs are astronomical compared to in-network costs, and that this is something their membership has discussed.
So how many customers are we talking about total? Is there any idea of the significance of this?
Florida Blue has said that more than 50,000 different people have used Baptist Health over the last 6 months. And that's 6 months of this year. Dr. Groover also mentioned that, on a daily basis, and not all of these are Florida Blue consumers, obviously, but Florida Blue is the largest insurer in the state of Florida, with more than 30% of all people with health insurance having Florida Blue. And Florida Blue, the percentages aren't available for Jacksonville and Northeast Florida, but both Florida Blue and Baptist and third-party analysts agree that Florida Blue has the largest market share in Jacksonville and Northeast Florida for health insurance. So Baptist sees 1,000 patients at its hospitals a day, does 400,000 ER visits annually, and 800,000 primary care visits annually. So these are two titans of our health insurance and healthcare industries.
Certainly visible on the skyline of the city, almost no matter where you go. If you're just joining us, we are talking about the Florida Blue and Baptist Health impasse. You can join the conversation live on air by calling 904-549-2937. You can also email us at firstcoastconnect@wjct.org or reach out on social media. So, Will, what are some of the local organizations that I know you've mentioned DTU, the Teachers United, but what are the local organizations somewhere that contract with Florida Blue for these employee benefits so we can maybe get an idea of what sectors of our population?
In addition to Duval teachers, St. John's teachers are also Florida Blue members. JEA JEA employees are Florida Blue members. Clay County government employees are Florida Blue members, and those are the public sector. There are scores of private businesses, but obviously their benefits packages aren't available online as readily, who also use Florida Blue as their health insurance option. A safe assumption is that Florida Blue has no fewer than 15% of the local health insurance marketplace. That number is probably higher than that, but a safe assumption from speaking to Florida Blue and Baptist is
And
that 15%.
with the large number of health institutions in this region, 15% is actually a pretty large number for one group. I can understand that. So along with those are those who have plans through the Affordable Care Act, Florida Blue. So let's take a listen to what Florida Blue's market president for Orlando and Jacksonville, his name is Tony Jenkins, had to say.
Baptist leaders have shared with us that if we don't agree to their excessive terms, then they are not going to serve our members that have signed up for marketplace plans or the Affordable Care Act plans. Think about it. These are the individuals that are typically your lower income folks, most vulnerable, and they have signed up for plans, and they've received, a lot of them, subsidies because they may not be able to afford a full cost of a plan, but they have coverage now. They have insurance now. And there are about 14,000 individuals that are on those plans.
And that was Tony Jenkins. He is the Florida Blue market president for Orlando and Jacksonville. So what is holding Florida Blue back from agreeing to Baptist's proposal?
Well, there are two things right now. The first of which is speaking with Dr. Groover and Mr. Michael Mayo, who's the president and CEO of Baptist Health, last week. They've mentioned that Baptist would like a 5-year hospital insurer agreement. Florida Blue has mentioned as recently as yesterday that they would prefer a 3-year deal. Now, where those negotiations are, they know. We don't. But another thing that is an impasse or kind of standing between the two right now is, healthcare costs have increased. There are studies that have indicated just how much healthcare costs have increased, and Baptist has said that the increase of healthcare costs is not increase. Their reimbursement is not increasing as much as their healthcare costs are increasing, and so they're looking to close that gap, per se, of how much the medical cost for drugs and supplies and labor is increasing. They want to be reimbursed more to cover up that gap.
We have a phone call, and there's a question about another hospital. So, Blake, you're on the north side. What's your question?
Well, my question is simple. Can you hear me?
Yes, I can hear you fine.
Okay. Obviously, and I may be oversimplifying here, but this question boils down to money, right? And I just thought we could get to the quick of it, get into the actual trench of it. Does Florida Blue feel like Baptist should cough up a little more? Is that the basic issue here? And my feeling on the issue is if that's the case, so then I think they should. I think Baptist is probably doing really well. They're like McDonald's. They sell a lot of burgers. And a lot of us are relying on Florida Blue. I have it. I work for a large construction company here in the city, and we all have it, and I'm counting on it to work. And I just want to know if we can, if that's the actual case, if it's that simple of a construct.
Thank you very much. Well, remember, Will Brown here, reporter from Jacksonville Today, is covering this issue. So we throw the question to you, Will.
Yeah. I would say that there is an impasse over money. Florida Blue has claimed that Baptist's negotiations would add what Florida Blue claims add up to nearly $900 million over the next 5 years, which would then be passed on to members. That's what Florida Blue claims. Baptist says the number is not that high. Now, the documents between how much it will cost, neither one of them felt super comfortable disclosing, in part because they're going through a negotiation, and they're both very hopeful that they will complete and have an agreement by September 30th.
That's what they're saying. Florida Blue obviously saying that there's some issues, but how is Baptist responding to this whole thing when you're talking about the he said?
Well, Baptist is saying that costs are increasing, and because the costs are increasing, they have to do something. They've mentioned inflationary pressures, which again, third-party analysts have indicated that there are prices that are, things that are higher. PricewaterhouseCoopers came out with an analysis earlier this year that said medical cost growth heading into 2025 is the highest year-over-year leap in 13 years. The previous agreement between Florida Blue and Baptist was 3 years. So what Baptist is essentially saying is our costs have increased. We need financial security from our health insurance, the people who we have health insurance agreements with, so that we can continue to provide the same care that we have consistently provided since 1955.
Well, sitting in the same newsroom with you, I hear you working, and I know you were working this story very intently. You've spoken with a lot of people, more than probably some other outlets. So you spoke with Michael Mayo, President and Chief Executive for Baptist Health, and here is what he had to say about reimbursement.
So like many health systems across the country in recent years, we have had serious labor shortage, increase in workforce costs, increase in supply costs, drug supplies, etc., all due to external factors that are beyond our control. And these factors build up over time. It's a compounding effect over the years, and it makes a gap unsustainable. And so we're seeking to fill that gap with a fair payment system from Florida Blue.
And well, as you've said, there's been certainly concerns about reimbursement. Florida Blue claims Baptist reimbursement demands would be financially catastrophic. So let's go back into that again. How so?
Well, they're saying that it would add costs to healthcare. Now, I am not a hospital administrator. I'm a journalist, and so I can't prove how much this will increase costs. But I did specifically ask Florida Blue's Tony Jenkins, will this increase costs for consumers, regardless of what the agreement is? And it is entirely possible that once this agreement is finalized, because they both believe one will be finalized, that people who have health insurance may pay a little bit more in premiums.
Okay, and now some of the notes that we've got here: $1.2 billion in added costs over 5 years. Baptist disagrees, argues Florida Blue is creating a false narrative and not properly mathing.
Well, I will safely say that I was not a math major in college, though I did ace a couple college math classes. But what I can say is what differs from this negotiation is how public it has been. Because we mentioned earlier Tammy Brooks Evans with Duval, with the teachers union. She specifically mentioned like 4 years ago that Baptist had similar negotiations with, I think, Florida Memorial Healthcare, which really has a number of hospitals in South Florida, but has a facility here. And that agreement was supposed to end at the end of August 2020. And it took them a couple extra weeks. And they finally reached an agreement in October of 2020. But she says this feels different. This negotiation feels different. Florida Blue has said they were a bit taken aback at how public these negotiations have been. There is a state statute 627.6043, that says a health insurer must give 45-day written notice of cancellation, non-renewal, or change in rates. And so earlier this month, Florida Blue has sent out letters to its members because of that law, because that 45-day window has begun.
Well, we're stacking up a lot of phone calls here with some comment or thoughts on this. Let's go first to Renata in Mandarin. Good morning, Renata.
Hi, nice to be with you. But this is so frustrating to me as a consumer. I and the previous caller had touched upon it. Is it about the money? So my question is, take a look at what the bonuses are for the CEO of Florida Blue as well as the hospital. And why doesn't that money filter down to us consumers to lower premiums? So nobody wants to give up, any money. And, they're trying to do their best, to cut costs here and there. But who benefits? It's not us, the consumers. It's the people in C-suite. So that's my comment, and I'd like to hear your input.
Thanks, Renata. Will, we always hear about what the CEO makes.
All I can say is both CEOs make more than I do. So that's about where I'll go. What they make is, it's something I can certainly look into. I had not looked into it yet. But I mean, that's a fair perception.
We're well aware that there were issues with COVID and lots of ER visits. We had a lot of burnout from nurses. Nurses were leaving. There's a nursing shortage nationwide. So those are issues there.
To that point, that is something Dr. Groover mentioned specifically, is that during the worst of the pandemic, people were holding off on on healthcare things that they could have. Like if you had heart issues, you weren't going to the hospital because COVID was very rampant. And so what Groover has said from a physician's standpoint, because he is a physician, and the day we spoke, he had actually done a surgery earlier that day, is people are coming to the hospital sicker now than they were at the before the onset of the pandemic, because there'd been so many years of people kind of putting their healthcare aside, or not visiting the hospital as much, or not visiting their physician as much because of concerns about COVID.
We got another call here. We've got Linda from Mandarin. Linda, you have some question about the lack of options in the insurance market, right?
Well, I think in America, with our capitalism, we always said, competition lowers costs. Well, what we're seeing is we've got hometown companies on each side, and it probably sounds good when companies got these big plans with the hometown hero, but when there's an impasse, I guess there's a lack of viable options. You go with the people but right now in a crunch, everything has shifted since COVID. So businesses need to rethink what they did in their contract pre-COVID, post-COVID. You need a COLA index or a contract extension or something. But right now, it's leaving the consumer, who has the giants fight it out, and you realize there weren't really viable options, possibly, because I'm sure businesses gave credit. Hey, we're hometown. We're going to give this business, go with us, get your group plan. But if they go away, I have both of them. And so right now I understand when I went to my doctor why I'm getting a bill saying, hey, I need you to pay this bill right now, because they're in contract negotiations.
Okay.
And cash flow must be a situation. But
thank you, Linda. She's got some points.
Yes. A lot of people are saying, some of the folks that I've spoken with are just like, hey, both of you do a lot of good in this community. Figure it out. That's been what my takeaway from a lot of different people. I was flipping through this notebook that I have right in front of me, because of a conversation I had with Therese Wakefield Gamble. She ran for state house and did not win, but she is somebody who has credited Baptist for saving her life, because of some health concerns that she had, and she had Florida Blue insurance. So there are just scores and scores of people who are impacted by these negotiations. And while both entities believe an agreement will be reached, when is the question?
Well, we've got another caller here. We've got Ken from Clay County who has a question about, will they still be covered? Ken, sorry.
Yeah, this is Ken from Clay County. My question is, I have Medicare as my primary and Blue Cross Blue Shield as my secondary. Now, I've called both these organizations and none of them can give me a clear answer on whether or not I'm going to be covered with Blue Cross Blue Shield in or out of network. That's my question.
All right. Thank you, Ken from Clay County.
That is one question I need to settle down with both. I wouldn't want to get on air and say something incorrect, especially at a time like this. I'm not 100% sure about the Medicare part of it. I do know that there are a certain number of services that will be considered in network regardless. There is a list in our story on Jax Today, but I will read a few right now on air. All emergency services, these are all things that will be considered in network on October 1st, regardless of what happens between the two. All emergency services, all office-based and virtual visits and therapies for Baptist Behavioral Health, Baptist Home Place on Demand, Baptist Home Health Care, Baptist Infusion Therapy, Care Spot Urgent Care, Horizon Surgery Center, in outpatient ambulatory services at Baptist Beaches and Baptist South, Jacksonville Orthopedic Center office visit therapies and procedures, Life Wellness Center, as well as Pavilion Respiratory Therapy, which is CPAP machines and supplies for home respiratory care. All of those things will be in network regardless of where the negotiations stand on October 1st.
And again, we're talking with Will Brown, reporter from Jacksonville Today, and Will has been covering the Florida Blue and Baptist Health contract negotiations, which have been very public. I've been around here for 40 years, and I don't remember hearing this much about this kind of contract ever. Normally, we talk about police and firefighters and things like that. So how have the two organizations outside of the news media been communicating? Just again, to reprise, how have they been telling their customers, their clients, what's happening and what they're doing about it?
Well, Baptist created a landing page of information. It has about a 3.5, 4-minute video from Dr. Groover outlining what may happen if this negotiation does not reach an agreement, and then it outlines where people can get more information about their care. A link to that landing page is in our story on Jax Today. Florida Blue has also created a landing page on its website. A link is also on jaxtoday.org.
Of course.
Of it from its perspective, as we mentioned earlier, Florida Blue by law had to send out notification that people's insurance may change within a 45-day window. We are within that 45-day window, so that is why people were receiving physical letters from Florida Blue. They've been in negotiations for since February, as we mentioned at the top of the show. My understanding is the last time they've been in negotiations, the two organizations at the table, was the first week of August. That is my understanding as of Monday. They are, kind of in consistent communication, but negotiations the last time were the first week of August.
Well, we've been getting a lot of calls today, and let's go to Curtis on the north side. Curtis, what's your comment or question?
Good morning, my brothers. Man, beautiful show, my brother. Beautiful show. And I'd like to thank Will Brown for his investigating reporting. I love what y'all do at First Coast Connect. Thank you so much. Keep up the good work.
Okay. Thank you. I guess the final question here is we've talked a lot about what these corporations are doing. We've heard from a large number of people who are concerned, but I know you were talking about what the enrollees are saying. What's the response as we're now, let's look at the calendar. We're now 40 days away-ish from that deadline.
Folks are concerned. They're concerned because of the uncertainty. Folks would like certainty. That's what I have been taking away. It's more, y'all figure it out. That is what I'm hearing from people who have Florida Blue, and use Baptist services. Figure it out. And so that's the takeaway.
So that's what people are saying. They're telling these corporations, guys, it's us that you're dealing with, not numbers, and work it out.
Right. Because again, 50,000 people, I mean, if you want a visual, however many people are going to file into Everbank Stadium for the Jags home opener next month, that's how many people are going to be impacted by this negotiation. Now, there are going to be more than 50,000 people in the stadium, but there are other people who may use Baptist services or may think to not use Baptist services if it's out of network. So, and I'm not saying they should or should not, but I'm saying there are, like, literally fill Everbank Stadium with people, and that is the size and scope of what we're talking about here.
So we got about a minute and a half to wrap. Any final thoughts on this? Because again, I've sat in the same newsroom. I've heard you meticulously interviewing and preparing to interview some of these CEOs, probably the only news organization to actually physically talk with the people involved. Any final thoughts?
I will be following this story until there's an agreement. I am consistently in communication with both organizations and will be so. Will do so. I am looking forward to listening to the perspectives of more people about what this means to them, because there are a number of people who have had some health odysseys, and I'm not a wealthy person, so I can tell you that out of network costs add up very fast.
Well, Jacksonville Today reporter Will Brown, thank you so much for coming on the program today. Up